Well, good afternoon. We wanted to invite everyone in and provide an update as we are now officially 1 week into second semester operations for Savannah-Chatham County Public School System. My name is Kurt Hediger. I am the Chief Public Affairs and Administrative Services Officer. I'm going to give you a general overview today of some of the work that the school district is doing and then allow some of our additional staff members to come forward from their respective functional areas to provide you some other specific information about goings-on across the district. One of the things that we look forward into the second semester is obviously we're excited that we're able to offer in-person learning for our families and for our students. This is a commitment of Savannah-Chatham County Public Schools and one that we will continue to maintain as a focus area that is supported by a layered mitigation strategy approach as we navigate through the pandemic. One of the things that we've recognized over the past year and a half is the need to make a pivot if necessary based on the health conditions in any given individual community or areas where we have valid concerns for potential transmission and spread, or if we're having resource conditions wherein we may not have enough staff availability to ensure that our schools can operate and function effectively. You'll note most recently that this week we had to do a pandemic pivot and shift 3 of our schools, our high schools, to a virtual format. One of the main reasons that's coming through is when you have a staff body that comprises of, say, 80-some staff, if you get 20 folks that are out due to COVID-related conditions, whether it's isolation or quarantine, you really can't function as a school and you really cannot provide quality educational services. So we quickly make a move and a decision and review all of the conditions, and it was determined that with those 3 schools, because of the staffing availabilities, that there was a need to shift to a virtual format. We've gotten pretty good at doing pandemic pivots and being able to shift into those formats, and we have a very strong infrastructure that is built across the school district to be able to provide the educational services in a virtual format when those conditions necessitate that to happen. But that is not our primary objective or our primary means that we would like to operate in as we go through second semester. We recognize that there is a spike and that there is significant community transmission index rise and spread within the communities. However, we also recognize that with quality mitigation strategies and staying vigilant in our schools with those layered protection conditions, that we can minimize the amount of transmission and spread within our own school communities. One of the things that we're very proud of, and we think that is at the forefront of this battle when you really look at the numbers overall as our school district, we're in about the 1% range of positives for students. And whenever we were back in November when the CTI was much lower, that was as low as 0.02%. So we're proud of that, and we watch that closely, and we do believe one of the reasons to celebrate being able to operate is because of our layered protection strategies, but really the big part of that as well at the forefront is vaccinations. So we've been working on over the last fall, second 9 weeks and in the fall of 2021, a targeted approach to our employees and our staff to encourage vaccinations and do it in a way that shows the benefit of providing that way of protection, not only for yourself, but for others around you, and in limiting the impacts of what this COVID virus can do and can have on the health conditions of our families, our students, and our staff overall. We estimate that we're probably in the 85%, upper 80% range of our staff body in vaccinations. These are verified numbers through a campaign that we had done to provide an incentive for folks to go out and get vaccinated if they had not. We still are trailing out on that particular endeavor, and we do have about additional 300 or so staff that we need to go back in and validate. But we've had more than 4,300 that we've done payouts for on that incentive that have verified that they are vaccinated. We recognize that at the forefront is having immense impact on the way that we approach our learning conditions for in-person and the way that we're able to move about across the school district in providing educational services in a safe way. So we commend everyone who's been engaged in that. We also recognize that education is key in this particular component. When we make a turn from day to day, it seems that there's new information or guidance coming out from the CDC or our local health partners. One of the ways to help us digest that and get quality information on the ground from the local communities is through a superintendent's medical advisory board that our superintendent, Dr. Ann Levette, put together with local health practitioners and medical staff in this area so that we could ask them pointed questions about the pandemic and things that we're doing to get their support, their guidance, and their feedback. And overwhelmingly, when we met with them before the 2-week winter holiday and when we met with some of them recently as last week, they overwhelmingly said you need to maintain your course, stay the course, enforce those mitigated, layered mitigation strategies from mask wearing in the classrooms and when you're moving about with crowds to the hand washing, the sanitizing, and all of the things that we're doing as really regular protocols, and of course also encouraging the continued education on vaccines for those who haven't got it and the booster application for those who are coming up with the booster components. So again, just to close, before I bring up Mr. Ramon Ray, our Chief Human Resources Officer, who can talk to you about some of the numbers across the district that we track and the way that we track those numbers and stay on top of that. And also he'll give you some input on our teams that come together and review situations when we feel that we may have to do a pandemic pivot or modify schedules within the schoolhouse or close down a particular classroom if we're seeing COVID transmission rates that fall in that way. But as a school district, we are committed to holding in-person learning 5 days a week. We do recognize that there is the potential and the likelihood for pandemic pivots to a virtual setting. So we want all of our parents and our families to know that there is the potential in any given week, depending on transmission or service availability from staff outages, that we could shift to virtual, and rolling closures could be something that is part of our regular narrative over the next couple of weeks. We also are getting feedback from our medical advisory committee that the expected spike from the holiday break was anticipated to happen about where we are right now and shortly after the Martin Luther King Jr. holiday, which would put us at about the 2.5-week period. We expect that that spike continues, that we're hopeful and expect that if folks continue to do the right thing and follow the guidance of the health professionals, that will begin to tail down again with the community transmission index in our area, which at that point we would begin to look at some of our restrictions for possible loosening. But right now we are maintaining the course with all of the restrictions that we had in place prior to the winter break, and we are maintaining the course with potential rolling closures to virtual, and committed though to staying open 5 days a week for in-person learning. So we'll do Q&A at the end when everybody's done with statements. I'll turn it over now to Mr. Ramon Ray to provide you updates on those topics that I mentioned.
Good afternoon. I just want to give you an update on what our processes are or what our process is. You may wonder, how do we end up getting to a point where we close the school? Well, we have an advisory committee that consists of the principal of the impacted school. You'll have an associate superintendent, several members of cabinet will be on there as well, and we will have a discussion along with the nursing services team. So we'll have a discussion about the cases, the impact of the cases, the number of students that could be out, the number of staff. I would say there's a difference between student impact and staff. The 2 high schools that or the 3 high schools that closed were based on staff. We did have 1 high school earlier in the year that closed based on students. So we will review that and see what is driving the need for a return, either a close, which we only had at one time, or a move to virtual, which we had this 3 times this week. So we moved to virtual this week because we didn't have enough staff. So that's kind of what that committee does. We provide advice to principals, advice to schools, and then sometimes we're just monitoring to see, is it getting better, is it getting worse? In a couple of situations we just had, actually more staff came back, kind of helped the situation. Others, more staff went out. So it just depends on where that is. As we look at the numbers, Mr. Hediger mentioned the 1% that we had in the fall. We actually were maybe up to about 1.3% was the highest point that we reached in the fall in August. We probably are over or close to 2% last week, but you have to put that in context. Last week meant that it happened while they were on break. So all these positive cases that we're reporting tomorrow are pretty much related to not in school, but what happened out of school while children and staff were on vacation. Next week, when we do the report, that will be an impact that's truly showing what's happening within the school, and we'll see where that is as it relates to that. But you will see the 3 schools that were closed showing a high number of staff that were actually not in school due to the virtual move that we have. So you'll see that as well. So that's what you'll see, and that's kind of how we monitor and we do, the move to pivot to when we pivot to virtual. The medical advisory board panel that the superintendent convened did support the mitigation strategies that we continue to do. As you know, there's conflicting information, or I wouldn't say conflicting information, different information coming from different sources. CDC is saying one thing, the Department of Health may be saying something else, a governor may be saying something else, and then we may have another entity that says do it this way. So all of it comes back to local and what our decisions are, and we ask our medical advisory board to kind of guide us in those decisions that we make. And so we've been doing that, and our medical advisory board has supported us continuing the way we are now. We do recognize that there are different types of information that I just mentioned, and we're reviewing those to see if we will make any adjustments in the coming weeks. But certainly as we look at CTI, the community transmission index, as high as it is, it's been correlating even in the fall with what's happening in our schools and our students. So we can expect that if that's high, our schools are going to be high. But we're committed to being open, and we're committed to being able to have those situations. We can't control it as much in a high school setting, but we can in the elementary and middle school setting to some degree. So that's why we know we can stay open in many, if not most of our cases. So I will turn it over to Ms. Ball Oliver, who is one of our our associate superintendent for secondary schools at this time.
Good afternoon. As Mr. Hediger and Mr. Ray shared with you, that we remain committed to having our schools open for in-person learning. That is our highest commitment, but we also recognize the fact that we have to be prepared to pivot to online instruction when needed. And one of the things that our schools, we've gotten very good at doing, is preparing to be prepared. So our principals work with their associate superintendents as well as their leadership teams to develop alternative plans in the event that they have to pivot a classroom, a grade level, or in the case of our 3 high schools, the entire school. And so what we would like to make clear as well to the community is that when we pivot, school is not closed. School is still operating. We have moved to an online virtual learning format. So our students are still expected to be in class, they're still expected to engage in instruction, and they're still expected to complete assignments. As you may know, the district has a learning management system, our It's Learning platform, and so our teachers utilize that to ensure that they are posting lessons, communication to parents, as well as links so that our students can log on and receive instruction and support from their teachers directly. Each school has this virtual learning plan, and the plan also contains a communication component so that they are able to communicate with parents via email, text messaging, as well as phone calls. So our governance team works directly with each principal. Each associate superintendent does that to ensure that that plan is in place, and so that when we need to pivot, we are able to do so. Our goal is to ensure that our students are still learning, be that in a virtual or in-person format, but again, recognizing that we prefer in-person learning. Also, I'd like to mention that the 3 high schools that closed, as Mr. Ray shared with you, that was due to staffing shortage and what we were experiencing with our staff. We are working with a community partner and providing testing opportunities for our staff and making that available to them. And at this time, I'd like to turn it back over to Mr. Hediger, or open the floor rather to you for any questions.
Any Q&A?
Yep, I have a couple of questions.
We'll try to identify the best person to answer and then they'll hit the podium.
So my first question is, are you guys still using the 3 key components, like identifiers? I remember you guys did it last year. I think CTI was one of them, positivity rate, things of that nature, to determine if you guys are going virtual or not, or what type of identifiers are you using to decide that?
To answer your question, we're not following any of the indicators to drive any decisions that we're making. We're looking at what happens in the individual school. So it ends on what's going on in that particular school. When we get to a point where we need to do that, it's probably going to be a system-wide decision. That's kind of how our decisions were in the past. If you recall, when we were virtual or when we were hybrid, it was a system-wide decision. But what we're doing is looking at each individual school and each individual situation, and that's how we address the situations currently.
And right now, as hospitalization rates are at the highest they've been during the entire pandemic, and pediatric hospitalizations are at an all-time high, and I believe they make up the majority of all hospitalizations in the country, I guess, does that cause you concern as we continue with in-person learning for the vast majority of schools here in Savannah?
Let's turn it over to Nurse Wilson, who's our district administrator.
Start out by saying go dogs. That was for you, Bernadette. So the question was, are we concerned with the number of pediatric illnesses that are being seen in the hospitalizations across the nation? And I would say that it would be foolish to not look at this information and consider it as something that is important. But we don't make our decisions, again, as has been stated, as to whether or not we're keeping our doors open or closing them on the nationwide numbers. We are looking at the information, but that is one of many determinants that we consider when we have students in the schools. We expect that the number of illnesses will be high. This is a very contagious variant. We have seen it, we expect it, but we continue with our current mitigation strategies in hopes that we can minimize our numbers to the best of our possibility and keep our doors open.
You mentioned at the individual school level, that's how the decisions are being made in deciding to go virtual or not. Can you describe the scenario that led to the 3 high schools needing to go virtual? You mentioned it was staff, more specifics about that.
Okay, let me.
Turn it over to Ms. Ball.
Okay.
So as the Associate Superintendent of Secondary Schools, I am notified of any concerns as it relates to staffing by the principal. And let me just share with you that all of the Associate Superintendents of Governance have been in contact with their principals on a daily in terms of monitoring their staff as well as student attendance. And so whenever we see patterns of increases or large numbers of persons who are close contacts or who are considered exposures, then that is when we actually reach out to Mr. Ray in Human Resources, and he convenes that team. And then we have the principal online as well as possibly an assistant principal, and they keep a tracking sheet. And so we're tracking the number of staff members, we're looking at the number of student absences, and we are determining, can we continue to provide the level of in-person instruction that is needed in order for school to continue operating. And so as a team, we discuss those factors, we look at the student schedules, and we look at whether or not we have enough substitutes to continue to provide assistance, as well as we look at, do we have enough district personnel, because we have deployed district personnel to schools to assist as subs as well. And so once the team examines all of those factors and look at the numbers, then the decision is made. in conjunction with every member of that team, which is comprised of our district nurses, with Nurse Lisa leading that area, communications, Mr. Hediger, and Mr. Ray, as well as Chief Terry Enoch, our chief of police. And we also involve transportation and food services that are supervised by Ms. Miller Kaker, our deputy superintendent.
Is there a percentage? I mean, it seems like you're doing a pretty quantitative analysis of the situation. Is there like a number where you realize, you know, at this number, we can't operate in teaching and instruction in the classroom?
So it would be different for every single school, depending on the number of students that are enrolled and the number of staff. And so what we do is lay out the master schedule and determine whether or not we would be able to actually have an adult that can provide instruction and or coverage and supervision for those classes. And if not, do we then have the staff to send in to assist in that area? And we look at whether or not we can sustain that for the period of days needed, if it's going to be 4 or 5 days for that school, and then we make a determination from there. So it varies from school to school because it's based on their master schedule, their student enrollment, and their staff numbers as well.
I'm sorry. I was wondering if the decision, you mentioned weekly earlier, the numbers, are you making a daily decision or is it a weekly decision on stuff like this?
It depends on the actual school. For example, all 3 schools, we met on those 3 schools on yesterday, but we had actually been monitoring their attendance and what was going on with their staff since last week.
Could someone briefly describe the mitigation efforts for COVID in the schools?
So, Nurse Lisa?
Since the beginning of the pandemic, we have worked diligently as a team to implement mitigation efforts that we felt would be instrumental in allowing us to continue to be in school and at work. Those efforts include good hand washing, the use of sanitizer, social distancing when at all possible, the use of face masks, and vaccinations, as well as boosters at this time.
Probably a question for the head nurse as well, but Mr. Vonnegut mentioned the last check there was over 80% of staff had been vaccinated. What are the protocols if someone's infected who's been vaccinated within the past 6 months or recently boosted? What protocols are you following? Are they still allowed to come and teach in the classroom as long as they're not displaying symptoms? Are you following CDC guidance?
Absolutely.
Okay.
We follow CDC guidelines as well as work. The question came up earlier about, are we looking at numbers daily or weekly? We are in communication with the Department of Public Health daily if necessary and at least weekly to discuss updating of protocols and what it is that we can do to continue to maintain our doors being open. Thank you.
And do you all have any preventative measures as far as maybe doing weekly testing with students, teachers, staff, to kind of get ahead of potential outbreaks or to get ahead of things that may occur within the next few months of the school year?
So to add to what Nurse Lisa shared and to also respond to your question as I shared, we do have a community partner that we're working with, and we will have 3 testing sites available for our staff. So our staff will be able to go and test. This is specific for Savannah-Chatham County School System employees, and so that's one way that will help us in regards to that. Also, one of the other strategies that we have utilized in schools as well as on our buses are seating charts, making sure that we are able to contact trace easily and be able to identify those kids that are, those students as well as staff that are considered close contact. Each of our schools have contact tracing teams, and as well as great educators, they've become great at contact tracing as well.
It was mentioned earlier that there were efforts to deal with possible outbreaks in elementary school level. I don't know if I think that's what I heard earlier, rather than high school, middle school. I mean, just thinking from a parent perspective, if you're in high school and middle school, you can probably stay at home to a certain degree. Elementary school, it's more disruptive to parents and that sort of thing when closures start happening or going virtual starts happening. Just speaking to what was mentioned earlier about the elementary school level, if you could elaborate more on that.
So I may need Mr. Ray to assist with that, but just saying that again, we look school by school, and at high school, because of the comprehensive nature of our schedule, it is very different for us as it is as opposed to an elementary school who may have grade level or classroom closures. So I'll let him speak to that.
Yes, and as elementary school, we can identify the class particularly, if it's a positive teacher or positive paraprofessional in a kindergarten or whatever the case may be. It's easier to isolate that. In a high school, those children are going all over the building, and so therefore we can't just reduce it by one class because it impacts so many. But in an elementary school, we can. So in elementary, you're going to see those small class closures. Middle school is probably the team. They're usually teams of 4, and you may see a team of 4, grade level 6 or grade level 7 or grade level 8. But you don't typically see the whole school go out. It's our expectation, at least from what we've seen so far.
To summarize that, it's easier to contact trace in the elementary levels because they're not moving around as much and you have seating charts. High schools, the kids aren't all co-mingled. You're going to have 9th, 10th graders in a class together, and it's very difficult to try and track all of that. So, you know, that's been a challenge area for us in some situations. But, and then the further to your point, the high school kids, yes, they're more situated to be able to learn virtually as opposed to elementary school. So as a guiding principle for us, that's important as well to make sure that elementary babies and kids are getting that in-person interaction.
So I guess one thing you can think about is what we're trying to do as it relates to the elementary. Those seating charts help us to narrow down the focus, narrow down the situation of how many children might be impacted. So that's the reason why we can narrow down what happens at an elementary school more differently than we can do it at a high school, for example.
I just wanted to mention this, you know, as support of what we're talking about with our mitigation efforts. This past week, Governor Kemp issued a statement that said contact tracing was no longer required or mandated, and as yet another preventative measure for the district, we are continuing with our contact tracing efforts ongoing as we have been since the beginning of the pandemic. We're also doing athletic testing. I'm not sure if we mentioned that earlier, but teams are being tested before athletic events. So there are a number of different things that are going on behind the scenes that may not be, you know, front and center, but we encourage our parents, if they have questions, to give us a call and ask those questions, because it's only by open communication that we're going to be able to continue to move through this third part of the pandemic process.
We've also done some reductions in our capacities as well as our travel in terms of field trips and other means. We've also done some reductions on that end as well and looked at the capacity and what was actually critical needs right now as it relates to program requirements for our schools.
Anybody else have any more questions?
Thank you all for being here.
Thank you.